Hey guys, today I will be discussing about Ascariasis. Ascariasis is an infection of small intestine caused by Ascaris lumbricoids. Before starting this topic, we will quickly go through a case report. A 3-year-old boy presented with acute abdominal pain, nausea, and vomiting. On examination, the child was malnourished. The stool examination revealed bile-stained eggs with thick albumin coat. You will be able to answer all these questions at the end of the video. Let's start. I will be discussing about Ascariasis under following headings. First, I will discuss the causative organism, followed by morphology, life cycle, pathogenesis, clinical features, laboratory diagnosis, treatment, and finally the prevention. Let's begin with causative organism and morphology of causative organism. Ascariasis is caused by Ascaris lumbricoids. Ascariasis is caused by Ascaris lumbricoids. Ascaris lumbricoids is also known as roundworm. Ascaris lumbricoids is also known as roundworm. Ascaris lumbricoids is the largest nematode and it exists in 3 morphological forms: adult worm, egg, and larva are the 3 morphological forms of Ascaris lumbricoids. Larva has 4 stages: L1, L2, L3 and L4. These are the 4 stages of larva. Female worm lays 2 types of eggs. One is fertilized egg and another type is unfertilized egg. Female worm lays 2 types of eggs. One is fertilized egg and another is unfertilized egg. Fertilized egg is round to oval in shape. Fertilized egg is round to oval in shape. It has a unsegmented ovum. Fertilized egg has an unsegmented ovum and it has clear crescentic space at both the poles. Fertilized egg has a clear crescentic space at both the poles. The shaded portion is the crescentic space and it is surrounded by a thick mammillated albuminous coat. Fertilized egg is surrounded by a thick mammillated albuminous coat. Unfertilized egg is elongated in shape and it has an atrophied ovum. Unfertilized egg contains an atrophied ovum and it is surrounded by a thin albumin coat. Unfertilized egg is surrounded by a thin albuminous coat. Fertilized egg was surrounded by thick mammillated albuminous coat, while unfertilized egg is surrounded by thin albuminous coat. And there is no crescentic space in unfertilized egg. If fertilized egg loses mammaliated albuminous coat, then it is known as decorticated fertilized egg. If fertilized egg loses thick mammaliated albuminous coat, then it is known as decorticated fertilized egg. Decorticated fertilized egg has lost thick mammaliated albuminous coat. This is an image of decorticated fertilized egg. We are done with morphology. Next I will discuss the life cycle of Ascaris lumbricoids. Embryonated egg containing L2 larva is the infective form. Embryonated egg containing L2 larva is the infective form of Ascaris lumbricoids. Man gets infected by ingestion of embryonated egg from contaminated soil, food and water. Man gets infected by ingestion of embryonated egg from contaminated soil, food and water. Embryonated egg contains L2 larva. Ascaris lumbricoids involves only one host, that is man. Man is the only host of Ascaris lumbricoids. Man gets infected by ingestion of food and water, that is contaminated with embryonated egg. Man gets infected by ingestion of food and water that is contaminated with embryonated eggs. Embryonated eggs. Following ingestion, the egg hatches out to release L2 larva. Following ingestion, the egg hatches out to release L2 larva. Embryonated egg contains L2 larva. Once you ingest the embryonated egg, it hatches out to release L2 larva. L2 larva molts once to form L3 larva. L2 larva will molt once to form L3 larva. L3 larva penetrates intestinal wall. L3 larva penetrates intestinal wall and reaches right side of heart via portal circulation. L3 larva reaches right side of heart via portal circulation. L3 larva reaches right side of heart via portal circulation. L3 larva from right side of heart reaches lungs via pulmonary capillaries. L3 larva from right side of heart reaches lungs via pulmonary capillaries. In lungs, L3 larva undergoes molting and forms L4 larva. In lungs, L3 larva undergoes molting and forms L4 larva. L4 larva migrates up to pharynx. L4 larva from lungs migrates up to pharynx. From pharynx, it re-enters intestine. From pharynx, L4 larva re-enters intestine. From pharynx, L4 larva re-enters intestine via swallowing. In small intestine, I will use short form for small intestine as SI. In small intestine, L4 larva undergoes final molt to develop into adult worm. In small intestine, L4 larva undergoes final molt to develop into adult worm. Following fertilization, female worm lays fertilized eggs. Following fertilization, female worm lays fertilized egg which are passed in fecus. These fertilized eggs are passed in fecus. In soil, fertilized egg molds twice to develop into embryonated egg. In soil, the fertilized egg molds twice to develop into embryonated egg, and this embryonated egg contains L2 larva. And this embryonated egg is infective form of Ascaris lumbricoids. This embryonated egg is the infective form of Ascaris lumbricoids, and man gets infected by ingestion of food and water that is contaminated with this embryonated egg. Sometimes female worm lays unembryonated egg before mating, and this unembryonated egg are not infective. Sometimes female worm lays unembryonated egg, unfertilized egg, sorry guys, female worm lays unfertilized egg before mating, which are passed in fecus, and these are not infective. We are done with life cycle. I will quickly summarize it, then we will go to the pathogenesis. Man gets infected by ingestion of food and water that is contaminated with embryonated egg. Embryonated egg contains L2 larva. Following ingestion, egg hatches out to release L2 larva. L2 larva molts to develop into L3 larva. L2 larva molts to develop into L3 larva, and L3 larva penetrates intestinal wall to reach right side of heart via portal circulation. From right side of heart, L3 larva reaches lungs via pulmonary capillaries. In lungs, L3 larva undergoes molting to develop into L4 larva. L4 larva migrates up to pharynx, and L4 larva re-enters intestine via swallowing. In small intestine, L4 larva undergoes final molt to develop into adult form. Following fertilization, female worm lays fertilized eggs which are passed in fecus. In soil, fertilized egg molts twice to develop into embryonated egg that contains L2 larva. And this embryonated egg is the infective form, and man gets infected by ingestion of the food and water that is contaminated with embryonated egg. Sometimes before mating, female worm lays unfertilized egg which are passed in fecus, and these are not infective. Next, I will discuss the pathogenesis. Pathogenesis caused by Ascariasis infection is attributed to 4 factors. One is host immune response, mechanical obstruction by adult worms, nutritional deficiency due to the presence of adult worms. Nutritional deficiency results because adult worms rob nutrition from host, and migration of larva results in pulmonary symptoms. We are done with pathogenesis. Next, I will discuss the clinical features. Incubation period is 60 to 70 days. Incubation period is 60 to 70 days, and pulmonary phase results from migrating larva in lungs. Pulmonary phase results from migrating larva in the lungs. Migrating larva in lungs provokes immune mediated hypersensitivity reaction. Migrating larva in lungs provokes immune mediated hypersensitivity reaction, which results in various clinical manifestations in pulmonary phase, and symptoms of pulmonary phase are observed in second week after ingestion of egg. Non-productive cough, chest discomfort, fever, and eosinophilic pneumonia are the various clinical manifestations observed in pulmonary phase. Non-productive cough, chest discomfort, fever, and eosinophilic pneumonia are the clinical manifestations observed in pulmonary phase. Intestinal phase results from adult worms in intestine, and majority of cases are asymptomatic. In intestinal phase, majority of cases are asymptomatic, and it results from adult worm in intestine. Malnutrition and growth retardation is observed in children less than 5 years. Malnutrition results from robbing of nutrition from host by adult worm. It results from robbing of nutrition from host by adult worm. This results in malnutrition and growth retardation in children less than 5 years of age. A large bolus of entangled worm. A large bolus of entangled worms can cause intestinal obstruction. A large bolus of entangled worms can cause intestinal obstruction and rarely perforation. Large worms can enter and occlude biliary colic and cause cholecystitis. A large worm can enter and occlude biliary tree, which results in cholecystitis, pancreatitis. Large worm can occlude biliary tree and it results in cholecystitis and pancreatitis. These are the extraintestinal complications due to immune mediated hypersensitivity reaction against adult worms. Various allergic manifestations like conjunctivitis. Conjunctivitis means inflammation of conjunctiva. Conjunctivitis, fever, angioneuritic edema can occur. These are the allergic manifestations. We are done with clinical manifestations. Next we will go to the laboratory diagnosis. Stool, sputum and the gastric aspirates are the samples collected for laboratory diagnosis. Either stool is the specimen of choice. You can collect sputum and gastric aspirates also for the lab diagnosis. Both fertilized and unfertilized egg of Ascaris lumbricoids are detected by saline and iodine wet mount. Both fertilized and unfertilized egg of Ascaris lumbricoids can be detected by saline and iodine wet mount. I have already discussed the features of fertilized and unfertilized egg under the morphology of Ascaris lumbricoids. Occasionally, adult worm can be detected in sputum or fecus by naked eye. Adult worm is cylindrical in shape. Adult worm is cylindrical in shape. Adult worm can be detected in intestine by barium meal X-ray of gastrointestinal tract. Ultrasound should be done to detect adult worm in intestinal sites. Ultrasound is done to detect adult worm in extraintestinal sites. Larva can be detected in sputum or gastric aspirates before egg appears in stool. Larva can be seen in sputum or gastric aspirates before egg appears in stool. Antibody can be detected by ELISA. Though it's sensitive, but it cannot differentiate recent and past infection. Though it's sensitive, it cannot differentiate recent and past infection. Antibody is detected by ELISA. It's sensitive, but it cannot differentiate between recent and past infection. Molecular methods such as PCR, real-time PCR. Real-time PCR is used to quantify the parasite load. Real-time PCR is used to quantify the parasitic load. Multiplex PCR can simultaneously differentiate between Ascaris, trichuris and hookworm. Multiplex PCR can simultaneously differentiate whether the organism is Ascaris or trichuris or hookworm. We are done with lab diagnosis. Next, I will discuss the treatment and prevention. Ascariasis is treated with antiparasitic drugs. Antiparasitic drugs like albendazole or mebendazole is recommended. Albendazole is given in single dose. 400 mg of albendazole is given in single dose. Mebendazole is given 2 times a day for 3 days. 100 mg of mebendazole is given 2 times a day for 3 days. Both these drugs are contradicted in children less than 2 years and pregnant women. Albendazole and mebendazole is contradicted in children less than 2 years and pregnant women. Ivermectin and nitazoxanide are alternative drugs. In severe infections, partial intestinal obstruction is managed with nasogastric suction and IV fluid administration. Complete intestinal obstruction requires immediate surgical intervention. Ascariasis can be prevented by not using the human fecus for soil fertilization and effective fecal disposal, use of sanitary latrines. We are done with Ascariasis. Now go back and answer the case report which I had shown at the starting of the video, because you can get a similar type of case report in your university exams. Thank you.